Hey, it's almost fall time, and in October to December 7th is the annual enrollment period. All of you guys are getting ready to receive this important letter from Medicare, and if you don't know what it is, stick around. I'm going to explain exactly what you're getting this year. So a lot of times people are very confused. This time of year, going into October, November, and going all the way up to December 7th, you are beginning to be bombarded by text, by phone calls, by mail, by snail mail, and tons of snail mail are going to be coming in. One of the most important letters you're going to be looking for that's going to be coming from your carrier or from Medicare, as I said just in the intro, is called the ANOC, the Annual Notice of Change. This is going to tell you about all the changes in comparison to this year going into next year. It's super important for you guys that are on Medicare Advantage and prescription drug plans, because in the Medicare Advantage world, they work and operate off of a summary of benefits. You're going to have a premium, a max out of pocket, a deductible, and then it's going to list all the Part A and Part B services, and then the copay amount when you access care. Like when I go to the primary care doctor, I have a $0 copay or a $10 copay. If I go to a specialist, I may have a $15 or a $30 copay. And so what the ANOC does is it actually gives you a side-by-side comparison when you're looking at that documentation and your evidence of coverage. It's going to go over, and I'm going to go through exactly how to look at the ANOC correctly and how to read it correctly, and then go over how to read and go through the evidence of coverage correctly, so you're not missing anything that's super important. But it's so important for you to realize when this ANOC comes in, it tells you a lot of information about coming into the first of the year. This is one of the most important documents. Stick around, I'm going to walk you through exactly how to read your ANOC. So one of the most important things that you want to be able to do is thumb through and walk through the summary of changes first. So I like to say the 2025 view, the 2026 view. It's going to go over the copay changes. You're going to see if there's formulary changes. Maybe a medication that you've been taking is on the formulary now, but next year that medication is not going to be on the formulary. That is a huge thing that you need to look for, is your medication. Okay, this year it's covered, next year it's not. What do I need to do? More than likely you need to change your plan, and you need to look at your options, or know that you've communicated with your doctor and said, hey, this is changing on my formulary. I'm on this medication. Is there another medication you can change me to based on this new formulary? And if there's not, you need to be able to look at what plan options. And again, we can help you with that. So another thing is making sure that you circle or make notes if you want to. Depends on how you like to do this, on a pen and paper, or you make notes in your ANOC, or if you have some post-it notes, post-it note with a little note on the pages that you have concerns about. And then you need to talk to somebody as a licensed agent and professional and say, hey, I've got concerns. My copays are changing on access to care, or my medications that were covered this year are not going to be covered next year. The cost of my medication has changed. The tier of my medication has changed. Then also you want to check your doctors and hospitals. Now, we have a digital platform that we use when we put people's medications in, their doctors or specialists. Anyway, we look at that information. A lot of times we're being referred a business in areas where we kind of know the networks when it comes to Medicare Advantage plan. But you need to be assertive and make sure you're touching base with your primary care, your specialists, and the hospitals, because Medicare Advantage plans often change their network contracts with doctors, specialists, and hospitals going into the fall of the year that go into effect the first of the year. Now, that doesn't mean sometimes they don't change in the middle of the year. Sometimes a hospital comes out of contract with the Medicare Advantage carrier in the middle of the year, and it creates all kinds of chaos. We've had that in our markets a couple of different times. And then sometimes they resolve that contract and then they push it and say, we're not going to change anything until January 1st, because the hospital doesn't want to look stupid, nor does the Medicare health plan want to look stupid, and they try to reconcile their differences, and usually it's dealing with money. But you need to be assertive and aware. Is my primary care doctor taking my plan next year? Is my specialist taking my plan next year? Is the hospital or hospitals that I like to access care taking the plan that I'm on? Very important to look at that when it comes to pertaining to the annual notice of change. Now, we're going to go over the evidence of coverage and the talking points that are important about the evidence of coverage. So in your evidence of coverage, you want to use the table of contents to jump to the coverage benefits. Also looking at the prior authorization rules. Prior authorization rules sometimes change. Last year, it could have been the doctor has to authorize before you have X procedure done. This year, it may be an additional step for another procedure you're looking at having done. Sometimes Medicare Advantage plans kind of have all the general prior authorization requirements. I call those the golden handcuffs of Medicare Advantage. If you're aware of how prior authorization works. Medicare Advantage plans are great in heavily networked areas, and then you understand these rules, but you want to look for this in the evidence of coverage. Also, you want to look for the appeals process, traveling and visitor coverage. This is another big one. Several years ago, if you went outside of the United States, and most Medicare Advantage plans, it would cover up to $100,000. Pretty good coverage overseas. You come back with the bills, you submit it to your Medicare Advantage carrier, they reconcile that 2-3 months later, you just pay a copay amount for the access of care that you had overseas. Now that's dropped down to almost every Medicare Advantage plan is going to be no more than $50,000, some $25,000. And there's confusion in that because people say, well, I have out of network. Well, out of network means out of network in the United States. In the 50 states of the United States, you have access to out of network. Out of network also does not mean just because you're out of network, you can go to any doctor, any specialist, in any hospital. They have to choose to accept the terms and conditions to be able to bill the Medicare Advantage plan that you have. Again, ask questions. If you're unconcerned or concerned about what plan should I go on, deal with a licensed professional that knows what they're doing. They should be able to guide, like us, we guide people through the questions to ask. Call the doctor and ask, do you take this specific plan? Again, don't call and go, hey, do you take Humana? They may say yes. The little girl at the front desk will say yes to a lot of things. But if you explain what plan you're looking at, and for us, we're going to tell you this is the plan you're looking at, here's the plan name, you need to call, because sometimes the doctor takes 3 PPO plans but won't take 2. They may take 2 HMO plans but won't take the other 2 plans for that carrier. They have different contracts sometimes with different plans. Very important for you to be aware of the evidence of coverage and when it comes to the rules and changes. Flag pages on your non-coverage services, out-of-network cost and grievance and timely appeal processes and things like that. So if you discover like, hey, last year it covered this, or 2 years ago, 3 years ago, I'd never even read this thing until I watched Kelby talk about it. Now I'm reading this and I'm like, oh my gosh, I'm left holding the bag on this service, and you're worried about something, make a note. Ask a licensed professional like us to walk you through and answer those questions. Sometimes it's just the confusion of the verbiage, and simplifying that down to explain how the coverage works is very important for you to understand. So you need to be watching for this other huge thing called the termination or non-renewal letter. If that comes in the mail and it's communicating your Medicare Advantage plan is not going to be renewed, it's going to be terminated. It'll say as of December 31st, this plan will no longer be available. You will go back to original Medicare and nothing else if you do not choose to make any action towards choosing a plan. So it's very important that you at this point go, hey, I need to deal with somebody that knows what they're doing and educate me on my options, because you're going to have a couple of different options. One, during the annual enrollment period, October to December 7th, you can look at all the plans available. From the 15th of October to December 7th, you can choose the plan that's the best fit for you if you're choosing a Medicare Advantage plan. Again, if you're on an MA plan, like you're a veteran, you get your medications at the VA, then you may just stay on an MA plan and revolve to another MA plan. If you're on a PPO plan, there actually may be a HMO plan explained to you correctly in the right area that actually has much lower costs, more benefits, better coverage, and having somebody educate you through that process. So you can enroll into another Medicare Advantage plan and go effective January 1st. Or you can enroll into a Medicare supplement, again, using the guaranteed issue based in the state and the area. You're going to be able to go into a guaranteed issue with no underwriting. That is the big key. So if you have catastrophic health issues going on and you have had a lot of costs out of pocket for your Medicare Advantage plan, it is the perfect time when you get a termination letter for your Medicare Advantage plan. It should make you want to dance, because you can enroll into a Medicare supplement without any underwriting. Again, choosing a prescription drug plan is so important because you have to have your medical Part A and Part B services covered with the supplement, and then a drug plan to go alongside of that. So that's super important for you to understand. If you get a termination, you don't understand, if you don't have a licensed professional like us, guys, I would say set up a time, allow us to review, look at what's going on, give you your options based in the area, and tell you what's best for you and the best fit for you moving forward in 2026. It's very important to watch your mail, pick up the annual notice of change, read anything from terminations to non-renewal letters and things like that. Pay attention. This season is going to be catastrophic for they're saying now over 1 million people are losing coverage. And again, the big eye-opener, 600,000 people with just one carrier with Medicare Advantage plans are going to be losing their plans come January 1st. If you're on that carrier's plan and you're unaware of that, you're going to show up January 1st and beyond at your doctor with your card, whipping it out and giving it to them, and then you're going to find out your coverage is not effective when you could have done something in October, November, and December to have the right coverage, the right plan for January 1st. It's very important for you to reach out and talk to somebody. If you haven't done that, click below. We'd love to be able to set up a time. We'll talk to you soon.